Good afternoon, and welcome to Your Health is Wealth. I'm your host, Dr. Stephen Katz, alongside my co-host, Dr. Loreena Ryder. We are here to help guide you on your journey to wellness, but we like to do it simply without all of that horrible medical terminology that everybody hates. We like to help you help yourself. Let's make it shorter today.
Sure. Today, we're basically just going to be having conversation about a question, and that question is, are you causing your own pain? This topic today is pretty much about an alternative medicine perspective, and I feel as though in this episode we're going to be countering a lot of people's excuses. And we're not exempt from this. We're people. We have excuses too. So try not to feel attacked. But we're going to talk about the way we live today. People.
We're people. Mm-hmm. Oh, maybe.
Sometimes.
We like to do quotes sometimes too, and one of the quotes is, it's a cliche that we want to be the best we can be, but so often we don't take action towards that. As physicians, we see this a lot. We tell everybody, or we hear all the time, that they've been hurt for 20 years but never actually wanted to move forward with their healing. And truthfully, the first step forward is showing up. And it sounds so obvious, but getting people to show up oftentimes is the hardest step for them to do. And once they're there, they're great.
Yeah, because people can have all of these grand plans in their head. And a lot of times they are really great plans. But if you don't actually follow through and take a step on your own to create action to that plan, you will be staying in the same exact place with the plans in your head.
Yeah, and one of my favorite quotes is, when you fall forward, or when you fall on your face, you're still moving forward. So it's kind of, yeah. So think about it, like you're going to do things and you're going to make mistakes along the way. And that doesn't mean you give up and you failed. No, you learn from your mistake and you move forward. And you can do the exact same thing with health. When you're talking about eating wrong or not taking care of yourself, you could know exactly what food is causing your problem and still eat it anyway. And then when you eat it, you feel like crap. And then you're like, oh, I knew I wasn't supposed to do that.
And then you'll try it again in 3 days.
And then you do it again.
See if it happens again.
And eventually you say, okay, maybe I shouldn't keep doing this.
Yeah, there is definitely an element of willpower when it comes to saying no, or even making a plan to step forward and then actually stepping forward. You really need to have that sense of self-control and autonomy.
And again, expect failures along the way, and that doesn't mean give up. It's so vital. So when we say, are you causing your own pain? If you're eating wrong and you know it's wrong, then the answer to that question is obviously yes. So how do you fix that? You start eating right. And when you make a mistake, don't compound that mistake. So many people have a bad Friday, and then they're like, I had one bad meal on Friday, so Friday's ruined, so now I'm going to eat all bad meals on Friday. Then you're like, Friday's kind of connected to the weekend, so now I'm going to have a bad Saturday and Sunday as well. Then you're like, the week's already screwed up, so now they end up eating bad 5-6 days in a row.
It happens all the
And
time.
we do that, and if you say you don't do that, you're a liar.
Speaking of liars, let's start out with a quote from Medicare. Did I say that? Care that seeks to prevent disease, promote health, and prolong and enhance the quality of life is not considered medically necessary.
Think about that. This is what we all pay in every single paycheck from basically when you start working at 15 or 16 years old. Throughout your entire career, you put money of every paycheck to Medicare. And right in the handbook of Medicare, it tells you that care that seeks to prevent disease, promote health, and prolong and enhance your life is not medically necessary. So what the hell are we paying for? Death.
I'm lost for words with this.
But again, it's government run, and that's what happens. When you think of government, you think of death.
It cracks me up whenever whenever you're dealing with insurance, they will ask for a code so that the insurance company will pay for your test. And vitamin D test is one of the tests that they seem to have a hard time paying for. And one of the codes that would cover that lab is a vitamin D deficiency. But you can't find out if you have a vitamin D deficiency without running the lab. So it is a vicious circle. It's hold on a second. How can we prevent vitamin D deficiency without checking it, but then having the insurance help out by paying for it?
I'll go even further than that. I got a letter from Medicare earlier in the week basically telling me, threatening me that if I write labs that are not necessary, they're going to send me a fine.
Whoa.
Like, I'm sitting there like, how the hell do you know what is necessary for my patient?
Yeah.
They know nothing about my patient. And yet I wrote labs that were relevant to the patient, and I got a nasty letter from them saying if I do stuff like that, because they don't want to pay for things that work, because insurance doesn't pay for things that work.
Yeah.
They pay for sick care. They pay for your drugs. They pay for surgery. When it comes to prevention, it's not medically necessary.
And that being said, that's where cash pay comes in, and the cash discounts and HSA accounts, and taking control of your health and making the decisions that are best for you. Yes, we pay insurance. Yes, we pay Medicare. Yes, we pay in. But there are ways that you can manipulate that to benefit you most and how you live your life and what's smartest for your finances.
But insurance doesn't mean good either, though. Again, you're getting bad care to start with. But the other thing is like an MRI. When you go through insurance, if you have a high deductible on your MRI, you're paying almost full price for that MRI, and you're going to get billed the insurance price, which can be $1,000, sometimes even more. Go call your local Simon Med or Smile and ask them what the cash rate of that lab or that MRI is. Most of the time it's $400, maybe $500.
Yeah, I just got one. Depends on the body part, but it was $250.
Yeah. I guarantee if you're using insurance, unless you've hit your deductible, you're paying a heck of a lot more than $250.
Yeah.
But again, ask yourself too, okay, I'm paying all this insurance, and I'm not saying don't have insurance either. It's just saying I'm paying for all this insurance, and I feel like crap. I'm seeing my doctor. I'm seeing this doctor. I'm seeing that doctor. I'm seeing a revolving door of doctors, and I feel like crap. So what are you getting out of it? You're getting bad care.
Yeah, I really think, and today I hope that we encourage folks to become an advocate in their own healthcare. You really do need to take a huge part in your healthcare. Instead of just depending on your doctor, walking in and just saying, hey, just take care of me, fix me, whatever it is. You really need to know what's going on in your own life. You need to understand your labs, and hopefully your doctor is explaining those to you. And you need to maybe do some research on your own. Say, hey, I read about this lab on Google. What do you think?
This comes from the World Health Organization, who we all love and cherish. But they actually came out and said 90% of all diseases around today are not treatable through standard medical procedures.
Wow, what does that tell you?
90%. What does that tell you? Because they're not treating the cause, they're treating the symptoms. And when you treat only symptoms, you're not going to get better. It's fake better. If you want to be fake, great. There's a lot of fake in the world, but it's fake better. Because your blood pressure is normal does not mean that you treated the cause of why your blood pressure was high. And when you take your drugs with all of those side effects that these drugs have, you're not treating the cause. So if you don't treat the cause, you don't get better. You get fake better.
So far in this first segment, we said 90% of all disease isn't treated with standard medical care. The World Health Organization says that, and Medicare says that preventative disease and enhanced quality of life is not considered medically necessary.
Yeah. So if that doesn't make you excited for the conventional world of medicine, I don't know what will.
Thanks for tuning into Your Health is Wealth. We're the doctors from Naturopathic Physicians Group located in Scottsdale, Arizona.
So one of the biggest things we talk about almost every week is diet. And diet is one of the biggest causes of people to have pain. It's not always structural issues. It's that you're creating so much of your own inflammation. 80% of our body's inflammation comes from the digestive tract. So if we're eating poorly, we're going to make our structural stuff feel worse as well. Plus, what if you have abdominal pain? What if your pain is heartburn? All these other things that create pain are there. So when we are going to the grocery store, oftentimes we walk through the health food aisles. But what is a health food aisle now? Think about it. Like, what do you see when you walk through a grocery store and you walk through their health food section?
Usually it's supplements is what I'm thinking.
Yeah, but with food-wise, bread, candy. I've seen candy in the health food aisle. You've seen dairy. You've seen tons of things that would normally I'd be looking and say, why chips, crackers, why is this in the health food aisle? Because they're put in the health food aisle and then labeled with terms that we associate as healthy. And so from that standpoint, we're looking at it as people don't understand every term. Do these terms mean healthy or not? But they believe they are because one, they're in the health food aisle, and two, they're labeled as in this is good for you. Terms like organic. Does organic mean healthy to you?
If they are organic gummy bears, no.
They're going to have different colors on organic gummy bears because they're not fake colored, but they'll actually look the colors of fruit because they're actually using fruit juice. But are they healthy?
They don't do anything to benefit your health.
Yeah, organic sugar is still sugar. Organic gluten is still gluten. So the question then becomes, is gluten-free healthy?
Typically, it is also processed mush that is not necessarily beneficial to your health.
Yeah, a lot of gluten-free products taste decent now, and some of them still taste like you want to throw them against the wall and see if they even break. But in general, though, gluten-free does not mean healthy either. And oftentimes they have to add more sugar into gluten-free products because you lost out that tasty gluten in the process. So they have to make it taste better in the process, so they add more sugar. Go check this out. Go look at gluten-free bread and look at regular bread. The amount of sugar per slice tends to be a gram or two on regular bread, and on gluten-free it tends to be closer to 2 or 3 per slice. So they're adding an extra gram of sugar every time because they have to make it taste better.
Compensation.
They compensate. They overcompensate many times. But again, when you walk through these aisles again, you're looking at candy, cookies, crackers, all labeled gluten-free. They're labeled organic. They're labeled so many different things that makes you now think these are healthier foods.
Because I've been living this almost my whole life, the health aisle to me is going to be the produce aisle, the meat area, the fresh foods that come from a butcher, like what is actually a food and has not gone through a factory and has not gone through a processing and been put into a box or a bag or a can. Those are not health foods. It is fresh foods that's picked from the ground or from a butcher.
So now go into sugar. Sugar's so bad because we talk about it all the time. Why not artificial?
Sugar causes inflammation. It doesn't really matter if it's artificial or not. Artificial is worse. And the no sugar, that's what you're talking about, the no sugar.
Correct. Like when you see a product that says low calorie, less calorie, diet, less sugar, that usually means chemicals. It usually means fake sugars. Now, you go to a regular restaurant, most restaurants have NutraSweet, Equal, all of these artificial products right on the table. And they're there because people use them. Every tea shop, all these, they all have these just sitting right there waiting for you, all labeled sugar-free.
And they have likely been told by their conventional doctor, if they have diabetes, to use those products.
Yes, that is a very common thing. And the answer to that is...
That's a bad idea.
That's a bad idea. There's actually no research out there that tells people that using artificial sweeteners improves your diabetes. All it does is means you're eating less sugar. But the body doesn't know the difference. Well, it knows the difference, but it's like the body doesn't, it understands sweet more than it understands that it's sugar. So you will still produce chemical components in your body that will try to lower sugar, even if you're doing something artificial, which then ultimately increases your risk for insulin resistancy and actually increases your risk of furthering along the pathway or worsening your type 2 diabetes. Every research thing comes out there shows this is completely true, that artificial sweeteners worsen your diabetes.
And then you have people saying, I have sugar cravings. And I understand those sugar cravings can really get in the driver's seat and make you make decisions that you don't want to make. Makes you reach for those sweets. And the people are thinking, if I do this no sugar substitute or this sugar-free cookie, hey, at least I'm not getting the sugar. But let's talk about why we're here today talking to you about alternative health perspectives and figure out why are you having sugar cravings in the first place? Perhaps you have a candida overgrowth, and that's probably something your conventional doctor hasn't mentioned or even believes in.
Or can spell. Sorry, they can probably spell it. But in general, when you're doing artificial flavors, artificial colors, artificial sweeteners, these things are toxic chemicals. Some of them are linked to cancer. Some are linked to neurological diseases and furthering your neurological diseases you already have. So now, put in perspective, the number one fear out there is cancer. Some of these cause cancer. And the second fear out there is Alzheimer's, and some of them cause neurological deficits. Why would we do stuff that further causes these problems?
Lack of information, which is why we're here.
And believing that sugar-free is better for you.
Yeah. There are things that we can do as naturopathic physicians for sugar cravings. And like I said, I get it. Sometimes they're so intense that you make these decisions based on that sugar craving. But there are ways you can calm it down. There are ways you can get rid of sugar cravings completely. And it is such a freedom. And guess what? Then say bye-bye to the diabetes, because then you'll start exercising, you'll have more energy, you'll make better decisions on food.
Yeah, let's dig into stress and how it deals with our pain as well. There's 3 different types of stressors out there. There's your physical stressors, your chemical stressors, and your emotional stressors.
And we talked, 2 weeks ago about stress in general, and it's important to note that there is positive stress and there's negative stress. And what you're talking about is the negative stress.
Yeah, because stress will create more inflammation. So if you've got pain in your body, the stress is going to make it worse. Now, some stressors you can control and some stressors you can't. So we're always talking about control what you can control. I say that, that phrase to so many patients. I've said it on the radio many times. I'll probably say it again today. It's just control what you can control, and that will already minimize a lot of the stress you deal with. Now, some physical stress you can't control. If you're in a car accident, if you are in a fight that you didn't start, again, not personal. If you are in any kind of physical trauma, if you were abused when you were younger, these are things you couldn't always control. And they will create problems. So you have to still be able to work through those physical stressors. If you have structural damage, you've got to treat the structural damage. If you were abused or something like that and you need counseling, you've got to seek the counselors to help you. If you don't do stuff like that, you'll never be able to fully get yourself 100% out of pain, because you're always going to have that deep-seated stressor behind you that will be in your subconscious and creating damage.
We're a whole being. There are many elements that, when added together, equals our whole being. And we're just saying this is probably the very most basic portion of us is our structure, our physical structure, which is recognized by the conventional world.
True, but they don't always treat it very well when it comes to structural, because that's when they're getting into the steroids and surgery and all this stuff that was not that can be more harmful than good sometimes. So again, we'll talk about the proper ways to treat structural damage later in the show. But ultimately, though, the understanding that you have to treat the structural aspects or you can't get better is vital. So thanks for tuning in to Your Health is Wealth.
We were talking about types of negative stress, and we talked about physical, which is structural stress, and now we'll talk about chemical stress. So we had mentioned the artificial sweeteners before, which are chemicals that you would place in your body, which will cause you chemical stress. Another big stressor out there in the world are heavy metal toxins. And I found that there's a misconception among patients who believe that they are likely not exposed to heavy metals if they haven't worked for maybe the military or lived under an airport or lived near a nuclear plant. But that's just not true, because heavy metals exist in our environment all the time because we're Earth.
We're Earth.
We are Earth. There is air, there is water, there's soil, and everything within Earth recirculates between those three things: air, earth, and soil, or water and soil. So you'll be getting exposed to whatever heavy metals are here on Earth, whether it's through the air that you're breathing, through the water that you're drinking, or through the plants that you eat that are grown in the soil.
So again, control what you can control. When we talked about physical stress last segment, we talked about how you can't control sometimes if you're in a fight, you can't control if you're in a car accident. But if you're a big time athlete and you're grinding all day long in your sport, you're going to put wear and tear on your body. That's a physical stress that you are creating on your own aspect there. And when it comes to chemical stress, you're using shampoos, deodorants, you're using makeup, you're using sunscreens. And I'm not saying don't do some of that, but not everybody does. But same thing, like sunscreen. Some people need sunscreen, some people don't need sunscreen. So when you're putting these chemicals on your body, that is a chemical stress. There's toxins in those things and they can cause damage in your body. Mm-hmm. So again, you have to realize that when you can control what you can control, you've got to be able to take some of those chemicals away if you want to feel better and have less pain. Like deodorant, it's aluminum. It's been linked to breast cancer.
Antiperspirant rather than
antiperspirant, the aluminum. Yeah, so it's like it's been linked to breast cancer, and yet everybody puts it on. Almost everybody puts it on.
I feel like that's a big movement that has made a lot of headlines that people actually do get. I feel like over the last 10 years, there's been a shift in that.
True, but I also
good.
hear a lot of people say the other stuff, the natural stuff doesn't work, and they'd rather not smell. I get it. For the sake of humanity, it probably is a nice thing not to smell. However, do you want breast cancer? You have to ask yourself, these are legitimate questions. Is using a natural product saving you potentially? You don't know. There's other causes for breast cancer, of course, but one less chemical is still better than
right.
the one more.
And honestly, if you are over the age of 40, regardless of the products that you use and have used in the past, you likely do have some toxic metals in your system because we grew up in an age where there was leaded fuel, leaded pipes, leaded paint, mercury thermometers that we broke open and rolled around in our hands.
Or plugged up your beep.
Metal fillings in our teeth. These things you can't control. You may need to test for that and then pull that out of your body.
And when you're talking about like emotional stress, that's the third stressor there. So many of these are controllable. How much politics you're willing to watch. Your sports, they are the biggest emotional stress out there. I can honestly tell you, they have given me so much heartache being a Cardinal fan over the years. The amount of emotional stress that the Cardinals have brought me in the past, I mean, I probably have enough to sue them. It's like the idea is, it's still my own fault, though. I still put myself into the position. It's actually my dad's fault. He takes me to the game since I was like 2 years old. It's his fault. I should have called CPS. The idea is how much I put into the Cardinals is a stressor on me. Now, if they win the Super Bowl, I feel less stressful, so it's their fault. But again, how much politics, how much TV news you watch, these are controllable things. Emotional stressors you can't control. If a loved one dies, if a bad breakup, these are the emotional stressors that you can't always control. But again, if you have a hormone imbalance, you might not be able to handle that stressor as well. So you still have to treat the cause. Mm-hmm. You can't avoid that stressor. But if you are good in your hormones, if your cortisol's good, if all of these things are good, you'll be able to handle that stressor better and it won't create as much inflammation and will help you with the pain.
Yeah, all of this, I talked about willpower and autonomy before. So this is true. It's, yes, you're living life, but if you are pointing the blame to other people like your dad or the deodorant.
Oh, it's his fault on the Cardinals, no doubt. And I'm going to inflict that same fault to my children as well.
Okay, that's fine.
Die hard.
Just keep it running down the family line. But like the food companies, why would they produce food if it's not good for us. It must be okay. When you point the other direction, what's the saying? You point at someone, you've got three fingers pointing back at you. You really have to take responsibility for what you're doing to your own body with all of these things, physical, chemical, and emotional. Now, like we said, some of the physical you just can't help. Some of all of it really you can't help.
All three of the major stressors, physical, chemical, emotional, some of them are controllable, some are not. Your ability to understand the ones you can control and your ability to handle the ones you can control will allow you to decrease the inflammation in your body significantly, and your pain will improve.
Mm-hmm. Let's go to another definition from the Macmillan Dictionary. This is about food, the purpose of food. That which is eaten to sustain life, provide energy, and promote growth and repair of tissues. That is what food is designed for.
So break that down into three segments. Sustain life. Does bad food help sustain life?
No.
No, but yet you have to eat. So again, if it has some stuff, it does sustain your life.
Well, I guess
if you're
it would keep
starving.
you alive, yes.
It will keep you alive.
Yeah.
Does it provide energy? Calories are calories. Calories break down. They give you energy. Fat breaks down. So yes, it does that. But does it help promote the growth and repair of tissues? That's where fake processed food fails every time. It damages your tissues. It promotes the death of your good cells. It does not help with growth. It does not help with repair. So if you're eating junk processed food out there, it fails as the actual definition of food. And so there's no benefit to processed foods out there. You can't eat processed foods and sustain a healthy lifestyle. Mm-hmm. It's just impossible.
It's true. I know some kids, they just really do grow up on processed diets almost from the time they're born till they're teenagers and make their own decisions. But I swear they're just growing on hormones. I don't understand how they actually do grow up. I know their brains aren't very as healthy as they could be.
No, but even if you look at foods like dairy where they say no added hormones, it still has hormones. Mm-hmm. It's breast milk from a cow. Earth-shattering news. Breast milk is full of hormones. It's not hormone-free. It just doesn't have added growth hormones. When people eat eggs, it's a chicken's period. There's no other way to look at it other than that chicken had its menstrual cycle and laid an egg.
Why don't we just add to this? Honey is bee vomit. What else you
got?
Bee
vomit. But again, honey has health properties, though, and it's raw and not in a teddy bear. Yeah. But again, if you're thinking these are hormone-free, they're not. They're just no added hormones. So if you are talking about how do they affect us, they 100% do. There's hormones in them, and they're going to interact with your body when you eat them, and they will mess with your hormones. Mm-hmm. That's why you have kids now that are like 7 and 8 years old going through puberty.
Totally.
Because they've been eating hormones their whole entire life and not human hormones. They're going to grow up to be a cow.
I did not say that. A cow or a chicken or a bee.
Aren't there people out there now that say they're cows and chickens?
Probably.
You can be what you want to be now,
yeah,
right?
Sure can.
So I'm a doctor today.
So hang out here with us. I promise we're going to get to the treatments. We're going to talk about healthiest foods. We're going to talk about foods that cause the most inflammation. And we're going to give you some ideas on how you can keep that pain down and that inflammation down naturally.
So, are you causing your own pain? If you're eating like crap, the answer is you're probably a part of the problem. So what are the healthiest foods? Obviously, fruits and veggies. Obviously, better when they're organic. When you're talking about where's your nutrition coming from, you got to get your vitamins, your minerals, all that other stuff. And the best way to do that is not through a bunch of supplements. Your best way to do that is through food, and fruits and veggies are your best way to get it. When you're talking about like proteins, lean meat proteins versus the higher inflammatory proteins. So you're talking like lean meats like chicken and turkey, organic again, not the ones from China. You want to get the ones that have good quality protein that our bodies digest. Now, if you're one of those red meat eaters, it's okay to have red meat here and there, but it should not be the staple meat product in most people's diet. Some people do very well with that. But when you're talking about what do you look for when you're doing red meat, grass-fed, grass finished, organic 100%. These are things that will mean that you're putting a lot less inflammation in the product. If your meat you're eating is corn-fed, not organic, they have to color these meats. When it comes to fish, a great source of protein, wild caught every single time, not sustainably farmed, not farmed. When they do stuff like that, it is just full of toxic metals and it is so much worse for you. And it can be exacerbating your problems.
Mm-hmm. Let's talk about foods that do cause the most inflammation, which will then in turn cause more pain. We talked about sugar. That's just regular processed sugar. Even artificial sugar is artificial sweetener is worse. Dairy, wheat, gluten, maybe eggs. I find eggs in most people. Processed foods, yes. Anything that comes in a box.
Remember, they're not eggs. They're chickens, period.
Chickens' menstrual cycles.
That's what we're going to call them.
So, yeah, anything that's been processed in a factory. Like, we are not biologically set up to eat processed foods. When we think about our ancestors, our cavemen ancestors, that really wasn't that long ago. This is a new development. We're eating new lab-created foods.
So a lot of times people say, well, there are tests for this. We've talked about it many times when it comes to healthy eating. You can always run a food analysis, a food panel. When you run a food panel, it tells you what foods your body reacts to. What better test can you run when it comes to inflammation in your body than what you put in your body? What's the number one thing you put in your body every day? Food and drinks. Mm-hmm. What's the number one thing you can control when it comes to your health? Food and drinks. Wouldn't you want to know what is causing damage?
I would. I have a lot of questions.
Yeah. And another one we get asked a lot is, can you supplement nutrition? The answer is no.
That's for with those reds and greens pills.
It's more along the, totally. They're like, hey, you can have your 8,000 days worth of your greens in one scoop. The idea is, can you really supplement nutrition? If you're eating like shit all day long and then you eat a few supplements, are you now healthy?
Nope.
No. If you're not taking care of yourself, you're not healthy. Mm-hmm. If you're not exercising, you're not healthy. You can't just take supplements and magically everything is better. Mm-hmm. No, they can help certain things, but it really is like robbing Peter to pay Paul. You're going to eat like crap and then take a supplement and now everything's better. You're going to eat a bunch of omega-6 foods and now I take a fish oil so everything's better. No, if you just took care of yourself, you wouldn't need the omega-3 in the first place.
And honestly, because food is so fake and processed these days, it is difficult to eat like you should. It's almost a full-time job to find the right foods, and they're more expensive. You can support your local farmers markets on the weekends. That's a really great place to get fresh fruits and vegetables and local farm-raised beef and chicken and so on. But it really is a full-time job. You have to plan it out. You have to prepare it. These healthy foods are not necessarily convenience foods. There are sometimes you can get like a somewhat healthy pre-prepared meal, but you have to do it at home. You have to cook the chicken. You have to cook the beef.
But that's part of the lifestyle change too that you have to commit to if you want to become healthy. It's a part of the process. It's not just, it's a commitment to your health. Our name of our show is Your Health is Wealth. Like, you could be a billionaire and have 10 diseases. You have no wealth. You have money. But you can't enjoy anything because you have no health. You're walking around, you're hurting. You're taking your pills every day because you feel terrible. Like, you need health in order to actually have wealth.
So let's talk about some treatments. Let's throw these in here really quick. Spinal manipulation. So that's your adjustments, your physical manipulations. Those actually, that addresses the structural part that we talked about earlier. Acupuncture. Getting on a weight loss program. We just talked about all the foods.
Yeah, finding out what foods cause inflammation. But when you do a test, you also find out what foods are good for you. They tell you which ones are not inflammatory. That's huge to put your actual nutrition panel together for not just wellness, to sustain the wellness. But even with acupuncture too, if you have food cravings, there's acupuncture points for food cravings. If you have pain, you can do it structurally. They have stuff that helps your heart. They have stuff that helps just whole body inflammation. It's way deeper than just pain.
As far as doing some regenerative injection therapy, this is a huge help for joints that have broken down, that have been damaged. that the cartilage is degrading, degenerative disc disease in the spine. This is fantastic. There's prolotherapy and there's PRP therapy injections. These are not steroid injections.
They're the opposite. These are those physical stressors. If you have physically been beaten up, whether it be self-inflicted wounds versus wounds that just happened, again, like car accidents, if these are the structural issues, these treatments are the ones that heal the pain. They will get in there and use your immune system to heal.
And just so you know, we use these ourselves. These are treatments that we use personally. So it's not just something that we're saying, go get this done. This is good for you.
You mean we're human?
Yeah.
Yes, we are human. We get hurt too. We are active adults. Things happen to us. And we need treatments too. And that's why these aren't just, promoted treatments for your health. These are the things we trust in ourselves and our families.
Yep. As far as supplements, collagen has been one of my best friends. I will use collagen several times a day, but it's really great for connective tissue and it helps reduce pain. We use this alongside those Prolo and PRP treatments. We'll tell people get your collagen in there because it's going to help the healing process as well.
And biotin, which is a B vitamin, is one of the great ones out there. And again, we're never telling you to stop or start anything. We're just telling you about the stuff we use with our patients. But every patient we have is individualized. So this is stuff you would talk with your doctor about before starting. But biotin is a great one, both for the physical stress and the emotional stress, because it's good physically because it helps with your connective tissue. Much collagen, it's really good for tendons, ligaments, and joints. But if you're one of those few people in the world that might have a little vanity in them, it's also really good for your hair, your skin, and your nails.
100%.
So yes, biotin.
Curcumin or turmeric is a really great anti-inflammatory and helps with pain. Most of the time you get your biggest concentration in a capsule, but you can also use this as a powder and mix it into your meals. I do this on a regular basis. It does get everything orange, so if you're picky with your towels, that might not be a good idea.
Unless you like the color orange.
Kitchen towels.
Ginger's a really great one too because, again, I like supplements that can do multiple things. Ginger's really good as a natural anti-inflammatory. It helps with mobility if you have autoimmune arthritis or osteoarthritis. But if 80% of our inflammation comes from the digestive tract, ginger's also really beneficial for digestive issues. It helps with acid reflux. It helps repair the digestive tract. It's also good for nausea and vomiting. So it can help you on multiple levels when it comes to stress.
100%. Astaxanthin is something that I think has become a little more trendy, but this is really fantastic with helping dealing with inflammation in the body. It's also really great for eye health, skin health, and I've seen a really great brand actually at Costco, just by the way.
Nice.
Yeah.
They did one right.
Yeah.
A lot of the Costco ones are very scary.
Right.
Some of them are pretty good, though. I've seen some good ones there. And then fish oil, again, wild caught, small fish. High dose omega-3s on there will increase anti-inflammatory properties and helps your body heal. Thank you guys for tuning in to Your Health is Wealth. We will see you with another great episode. Have a good week.